Bolavinaka. Today we are going to discuss about lupus, and here with me I have Kesa. Kesa is a mom to Ruby, who is also a patient of lupus. And today she is going to share a bit of what she goes through at home with Ruby. So we will hear from Kesa. Bolavinaka Kesa.
Mbula, my name is Kesa. I have a daughter in the family who has been diagnosed with lupus. Ruby is got diagnosed when she was 14 years old. First of all, we never knew that she had already had it when she was young. She started having symptoms early last year, where she had abnormal bruises showing up on her body. We were not aware that it was really serious. We thought it was just minor bruises that she got, probably from allergies. But we only found that it was serious when we took her to the hospital. The very first week we took her to the hospital, they had some blood tests done. We were asked to come back the following week to get the results of the blood test. Once the doctor came back with the result, her platelet was very low. That was causing the the abnormal bruises that were showing on her body. The doctors had told us that they will not allow Ruby to go back home because it was really serious. Her platelet count was at a very low level, and it was risky to let her go back home because something can happen at any time. When we were in hospital, we were asked if they could take other blood samples from her to test whether she had cancer or leukemia or any other blood disorder, disease that was known, that is known nowadays, that we usually get. Her SLE test, which is known to be systematic lupus, was the very last result that came out. We had done the cancer test, the leukemia test, all came out negative, but her SLE test was the last one to come out that became positive. That's how we knew that she has been diagnosed with lupus. That was late November last year. So yeah, we've been after she was diagnosed with lupus, the doctors had recommended if she could go for a long-term medication, and that long-term medication will be I think she has to take it every day, 2 medication. One is the prednisone tablet, and the other one is it's really hard for me. I find it difficult to pronounce the other tablet, but she's been taking that medication every day, and when she misses, sometimes she flares up, especially with prednisone. Prednisone is something that is to be controlled because it can also affect her liver and her kidney if it's not wind down because of her age. She is 15 years old, and prednisone is a hard drug that needs to be controlled when a child is taking it. So yeah, we've been going for her regular clinics. She goes every month, or sometimes before her clinic dates. When she flares up, we have to take her to the hospital. It's this disease is not is a disease that cannot be controlled at home. You need to go out um, to the hospital to get help, because it deals with our blood and our immune system. Um, so we've been this is the second year that she's been having her regular clinics. We've been now teaching ourselves at home, our families, to start learning about her disease. We've been telling our children so that we can understand what she goes through at times. Sometimes it's hard because some of the medication that she takes is the medication are very expensive, and some of the medical assistance she will need will be expensive at times. But we are trying all our best to assist her so that we can help her to take more care about herself, because it's not something that it's not something like flu to be treated like a flu or something. It's a long-term disease that she will have to live with at the rest of her whole life, and she needs to be taught to take care of herself. She's not allowed to some of the things she's not allowed to do is to not to take part in some activities like sporting activities, and she's not allowed to expose herself under the sunlight, because this is one of the diseases that she's a full-time I can say she's allergic to sunlight. If she gets exposed, then she flares up and she can faint even under the sun, exposed under the sun for so long. It doesn't mean that she cannot go out in the sun. No, she can go out in the sun, but using an umbrella or applying sunblocks that is especially specified for people with lupus. Education, she's been going to school. She goes to school like any other normal kid, but she is aware what to do and what not to do. We've told her what she won't be doing from now and what she has to do when something happens to her in school. We've taught her how to manage her own the disease that she has. Her teachers are aware. We've informed them. It's always important to inform their teachers so that they are aware, and sometimes when they go out to do sporting activities outside of the classroom, her teachers are aware and always inform her to stay in a shady area. So education wise, because Ruby is one of our brightest child, it doesn't affect her education a lot. She may be absent at times because we cannot send her to school depending on her condition, but otherwise it doesn't affect her schoolwork. Going in and out of the hospital when she's in hospital, she just got hospitalized last 2 weeks ago because she was having flares. Sometimes it's hard because when you have other kids at home and you have to go to the hospital and attend to her, yes, it's very challenging at times, but it's for her own good. That's why we have to follow doctor's orders on that. Managing this disease is not easy, but it's very challenging at times. especially when you are a parent, and this is not an easy disease, but we're introducing awareness can help people with this disease to be accepted in society. So yeah, I would encourage those parents with children who also have this disease is to try and take their children to the hospital, get doctor's advice. It will really help. Sometimes we always take things into our own hands and try and treat the patient at home. I would advise if please take your children to the hospital, get them checked. Even if you are one of the patients, always have regular visits and make sure do not miss any of the clinics, because this will help you combat the disease that you have, just like we are doing for you. Thank you.
Thank you. Renaka Kesa. So there you have it, everyone. So if we have anyone at home who suffers from lupus, or any of your friends at work or at school, please do take this advice seriously, and do seek medical help if the need arises. Thank you.